My name is Emmanuel Ekanem. I was born in Lagos, Nigeria. My entire family is from Nigeria, and I came to the States when I was about 10 or 11. But before then, my primary school was actually in the biggest teaching hospital in Nigeria. It was Lagos University Teaching Hospital. So going to school, coming back from school, I always sort of saw people in white coats, lab technicians, nurses, things like that. And then also, coming from a developing country, you sort of see firsthand the impact of healthcare disparities. And, I had family members, relatives, neighbors, just people who I knew who were impacted in that way, who had, negative outcomes, sometimes because of the severity of their illnesses, but oftentimes just because of access, just not having access to the appropriate care, either as a function of economics or, being able to fund that care. Or just not having that care available in their proximity. So I think coming from that environment, the importance of healthcare and the impact of having great healthcare available was huge. And so when I went through high school and college, I enjoyed the sciences, and so it was a very natural progression for me. I'm a cardiology fellow here at the Inova Fairfax Hospital. I did my medical school at George Washington School of Medicine in Washington, D.C. I did my internal medicine residency at Georgetown. At the conclusion of my residency, I actually took a position with the internal medicine department for a year as an internal medicine hospitalist. So I got a chance to work with the team there, teach the medical students, which was great, and the residents. And then I went on and joined the cardiology fellowship at its inception. And I was always intrigued by the cutting-edge care that was being delivered. They always seemed to be ahead of the curve from just the technological advances that were being employed at the bedside. The sheer, just comprehensive pathology that we got here, that was one of the things that was very appealing to me when I was in residency, because you really got a chance to see the gamut. You got access to a relatively diverse patient population as well. And as I got more training and more exposure, it was a natural fit. I think working with renowned experts in the field, being able to learn from them, particularly as a trainee in cardiology fellowship, has been, just profound. And I think that experience will stick with me for the rest of my career. I consider myself fortunate to have had that exposure from being here.